Hello everyone, welcome back. Today we'll be discussing about important questions from pharmacology. So here we are covering more than 150 questions. So let's start one by one. So maybe in one session if we can't complete, we will try to cover within 2 or 3 sessions. Okay, so let's start. Who called father of medicine? Option A, Louis Pasteur. Option B, Lord Lister. Option C, Hippocrates. Then Darwin. So, Hippocrates is called as father of medicine. See, Hippocrates is a Greek physician referred to as the father of medicine because he was the first healer to attempt to record medical experiences for future reference. A moral code for medical practitioners promulgated by Hippocrates called Hippocratic Oath. Clear? So that's why Hippocrates is called father of medicine. Next, who is known as Indian Hippocrates? Option A, Abraham Jacob, Hippocrates, Kashyapa, Susruta. So we know, right, that Indian medical history, Susruta is called Indian Hippocrates. See, Susruta considered as father of Indian medicine, right? So, father of Indian medicine is Susruta. Option D. Clear? Then what is sociological definition of word drug? See? Option A substance that changes mood, behavior or consciousness. Option B, a dysfunction. Option C, a chemical. Option D, ecology. So, drug का मतलब क्या है? Basically, it is a substance that changes mood, behavior or consciousness. Clear? Next question, name given to a drug by drug manufacturer. That is official name, generic name, chemical name, trade name. So that is basically a trade name because there are many manufacturers, right, that they can give any name according to their trade name, right? See, drug have 3 types of name, that is chemical name, IUPAC name of drug, generic or non-proprietary or official name. It is usually more complicated and harder to remember than brand names. Then trade name, brand or proprietary name. It is usually catchy because often related to drugs intended use, so easy to remember. For example, phenytoin is the generic name and dilantin is a brand name for the same drug. Clear? Like for easy example, I am telling you that paracetamol, it is a generic name and it is available as Dolo, somewhere it is Crocin. So like that. What type of nomenclature of drugs are catchy and easy to remember? Option A, chemical name, generic name, proprietary name or non-proprietary. That is option C. Right? Yeah. Option C, that was proprietary name. Then, which effect may lead to toxic reactions when a drug is taken continuously or repeatedly? Option A, refractoriness, then cumulative effect, tolerance and tachyphylaxis. That is cumulative effect. What is that? Cumulative effect of a drug means the effect that causes toxic reaction after several doses have been given continuously or repeatedly. Progressive decreases in effectiveness of a drug after its repeated use called drug tolerance or drug insensitivity. Diminishing responses to a drug after routine usage called tachyphylaxis. Then refractoriness means resistance to ordinary treatment. Clear? So here the answer will be cumulative effect. मतलब क्या है, कुछ दिन यूज करने के बाद उसका क्या है ना, टॉक्सिक रिएक्शन हो रहा है कुछ दिन बाद. दैट इज कॉल्ड क्यूमुलेटिव इफेक्ट. सो ऑप्शन बी विल बी द करेक्ट आंसर. नाउ decrease in response with a particular amount of drug, it is called, what is called, that is tolerance. So option A, resistance, addiction, tolerance and dependence. So here option C will be the correct answer. Tolerance and drug resistance can be consequence of drug dependence, increased metabolic degradation. Option C, depressed renal drug excretion. Option D, activation of a drug after hepatic fast pass. So what will be the answer? That is increased metabolic degradation. See, tolerance occurs due to increase in level of enzyme that cause degradation of metabolism of drug. That is, like example is CYP450, an enzyme involved in the metabolism of many drugs. It also be caused by increased excretion of drug due to chronic use. Then number 9, unwanted but unavoidable pharmacodynamics effect of a drug at the therapeutic dose is known as hypersensitivity, side effects, toxic effects, idiosyncrasy. What is that? That is side effect. Okay, मतलब क्या है, अगर इसमें क्या बोले है कि अनवांटेड मतलब हमें नहीं चाहिए वो इफेक्ट, बट अनएवॉइडेबल, लेकिन हमें हम वो अवॉइड भी नहीं कर सकते, क्योंकि मान लो अगेन पैरासिटामोल, आई एम टेकिंग द एग्जांपल, उसके कारण क्या हो सकता है, पेप्टिक अल्सर और गैस्ट्रिक अल्सर हो सकता है. तो देयर इज सम रिस्क of peptic ulcer, so that's why it is unavoidable sometimes, but we don't want that side effect. Clear? So the option B will be the correct answer. ADRs, that is adverse drug reaction, unintended, harmful or unpleasant reaction of a medicines at therapeutic dose. It classified into 2 types. Okay, that is, let's see. Type A reactions, it's sometimes referred to as augmented reaction, which are dose dependent and predictable on the basis of the pharmacology of the drug. Type B reaction में क्या है? It are bizarre, peculiar and individualized reaction which are idiosyncratic or and not predictable on the basis of the pharmacology. So there are 2 types of reaction, that is type A reaction and type B reaction. Clear? Now dose related adverse drug reaction is called, that is bizarre, augmented, end of use, failure. That is augmented. Now only we have studied that it is type A, it is augmented, मतलब predictable है ना. The unpredictable effect of a of medication in which a client overacts or underacts to a medication is termed as idiosyncratic reaction, side effects, allergic reaction और toxic effect. That is idiosyncratic, मतलब हमें नहीं पता है ना कब क्या होगा, ओवरएक्ट करेगा या अंडरएक्ट करेगा, वो हमें नहीं पता है. Unpredicted effect of a medication to a in which client will overact or underact. Clear? Now next question, generally determined abnormal response to a drug, तो क्या बोलते हैं, idiosyncrasy है ना. Next, pharmacodynamics involves the study of following except, क्या है, biological and therapeutic effects of drugs, absorption and distribution of drugs. Option C, mechanisms of drug action. Option D, drug interaction. So that is absorption and distribution of drugs. है ना. pharmacodynamics मतलब क्या है, what drug do in our body, और pharmacokinetics क्या है, what body does to drug. Clear? So see, pharmacodynamics and pharmacokinetics are the 2 branches of pharmacology. Pharmacodynamics means what drug does to the body. This is the perfect line है ना. Study of effect of drug on body, मतलब ड्रग हमारी बॉडी में जाके क्या कर रहा है, इसको बोलते हैं फार्माकोडायनामिक्स. क्लियर? इट इंक्लूड्स फिजियोलॉजिकल, थेराप्यूटिक एंड बायोकेमिकल इफेक्ट ऑफ ड्रग्स एंड देयर मैकेनिज्म ऑफ एक्शन एट ऑर्गन, सिस्टम एंड सेलुलर लेवल. इट गिव्स एम्फसाइजेस on dose response relationships. It means relationships between drug concentration and its effects. Now pharmacokinetics means what body does to the drug है ना. It includes like absorption, distribution, biotransformation, metabolism, excretion of drug. It describes time course of concentration. Hope it is clear. Now 14 में क्या है? What is called to the relationship between drug concentration and its effects? So options are pharmacokinetics, pharmacodynamics, pharmacogenomics and pharmacovigilance. That is pharmacodynamics. Concentration के ऊपर depend करता है. That is pharmacodynamics, है ना? Now process by which a drug alters cell physiology is called. That is option A, pharmacokinetics, pharmacodynamics, drug habituation, peak plasma level. मतलब drug alters cell physiology, right? मतलब drug कुछ कर रहा है. What drug does to the body? It is called pharmacodynamics. So option B will be the correct answer. Then what is called to the relationship between drug concentration and time? Pharmacokinetics, pharmacodynamics, pharmacogenomics and pharmacovigilance again. So that is option A, pharmacokinetics. Most drugs have a molecular weight between 1 to 10, 10 to 100, 100 to 500, greater than 500. So that is 100 to 500. Most drugs have molecular weight between 100 to 500. 80% of traded drugs have molecular weight under 500, between 200 to 500. Dalton, that is atomic mass unit, smaller molecular weight is better because they easily diffuse. है ना? अगर हमारा मान लो जितना बड़ा होगा उसको मतलब डिफ्यूज होने में टाइम लगेगा, इसलिए जितना स्मॉल होगा उतना हमें आसान हो जाएगा इजिली डिफ्यूज होने में. क्लियर? 18 में द रेट ऑफ ड्रग एब्सॉर्प्शन इज ग्रेटेस्ट इन द लार्ज इंटेस्टाइन, स्टोमैक, गॉल ब्लैडर एंड स्मॉल इंटेस्टाइन. ओके, ट्राई टू आंसर दिस वन. That is option D, small intestine. Absorbing surface area is larger in small intestine due to presence of villi and microvilli. Okay, so rate of drug absorption is greatest in the small intestine. So we know, right, that in GI system only small intestine is having like they are like coiled, na? So they are present of villi and microvilli. That's why absorbing surface will be more. And rate of drug absorption will be also more. Okay, now we are starting NSAID or non-steroidal anti-inflammatory drug. So let's start. 19 drug used to relieve pain are termed as anesthetics, analgesic, antidote, antipyretic. We know, right, that is called analgesic. Which of the following is a first line drug used for pain management? So पेन मैनेजमेंट में हमें क्या देना है? दैट इज एसिटामिनोफेन. ओके, इट इज ऑल्सो दैट इज पैरासिटामोल का जेनेरिक नेम. ओके, एसिटामिनोफेन. नाउ 21 क्लासिकल सब्सटेंस दैट इंक्रीजेस sensitivity of pain receptor by enhancing the pain provoking effect by bradykinin, that is nociceptors, encephalin, endorphin, prostaglandin. So that is prostaglandin. Okay, classical substance that increase sensitivity of pain receptor by enhancing the pain provoking effect of bradykinin, that is prostaglandin. So prostaglandins are responsible for pain by increasing sensitivity of pain receptor by a mediator of pain provoking substance like bradykinins. It produces prostaglandins. Clear? So our next question, that is, in caring for a child following accidental ingestion of acetaminophen, which laboratory value should nurse monitor most closely for changes in child's health status? So क्या होगा? Hemoglobin and hematocrit, white blood cell count and differential, then blood gases PO2, PCO2 and pH, serum transaminase level, that is ALT and AST. So what will be the correct answer? That is option D, serum transaminase level, ALT and AST. Acetaminophen, that is paracetamol, a drug with antipyretic and analgesic effect and with limited anti-inflammatory effects. Overdose of it in children below 10 years cause injury or necrosis of liver, hepatic failure. So serum transaminase level should check regular to assess liver function for chronic user of acetaminophen client. In children, it also causes hepatic encephalopathy if child have viral, that is varicella infection, because aspirin with viral infection cause Reye syndrome. Hope it is clear. Next question is 23. Which of the following lab test result is most important for nurse to follow in monitoring the care of the patient with an acetaminophen overdose or with a prolonged use? So let's see. Option A, WBC count. Option B, chest x-ray, bleeding time and liver function test. So that is option D, liver function test. Now next is 24. The paracetamol is not given to those patients who are already suffering from liver disorder, kidney disorder, lung disorder, GIT disorder. So we know, right, that if we are over counting on the drugs, those are available without any prescription from the medical store, like paracetamol is an example. So from this type of medication, mainly this paracetamol is cause liver, like hepatotoxicity. So that's why if patient is already having liver disorder, we are not giving this drug to the patient. Is clear? Next question. Which of the following drug has the highest toxicity to a child? Option A, salbutamol. Option B, tricyclic antidepressant. Paracetamol, oral contraceptive. मतलब क्या होगा फिर, कौन सा वाला सबसे ज्यादा टॉक्सिसिटी होगा एक बच्चे के लिए? Option C has the highest toxicity to a child. Then option C will be the correct answer. Which one of the following analgesic drug lacks anti-inflammatory action? Option A, piroxicam, diclofenac sodium, then paracetamol. Option D, ibuprofen. So here it is again paracetamol. Clear? What is the chemical name of aspirin? Acetic salicylic acid, acetyl salicylic acid, acetone salicylic acid, or amide salicylic acid? So you have to remember that is called acetyl salicylic acid. See, aspirin chemical name is acetyl salicylic acid, is a like one of the most widely used and prescribed analgesic, antipyretic, anti-inflammatory and antiplatelet agents. If it prolonged BT, what is BT? That is bleeding time, है ना? Hope it is clear. The effects of aspirin do not include. What will be the correct answer? Option A, reduction of fever, reduction of prostaglandin synthesis in inflamed tissues, impaired autoregulation of kidney function, reduction of bleeding tendency. So obviously option D will be the correct answer. है ना? Because aspirin will increase, not reduce bleeding tendency due to its antiplatelet effects. Okay, I'm using different color. Yeah. Then aspirin may cause a reversible decline in renal function and a decrease in glomerular filtration that may cause water, sodium, potassium retention. So option A will be the correct answer. Now 29. Which of the following is most common side effect of aspirin? Option A, gastrointestinal bleeding. Option B, constipation. Option C is urinary incontinence. Option D is nystagmus. So here option A will be the correct answer, gastrointestinal bleeding. See, long-term use of aspirin, right? Large dose of aspirin, it will decrease synthesis of clotting factor in liver and prevent platelet adhesiveness. So increase bleeding chances like gastrointestinal and genitourinary bleeding cause pink urine. Clear? Now, which symptom of aspirin toxicity should be checked by a nurse first? Option A, hypertension. Option B, dizziness. Option C is pink urine. Option D is drowsiness. So option C will be the correct answer, that is pink urine. Clear? Yeah. 31. Before discharge from hospital, nurse should teach the child and parents to closely monitor for toxic effect of aspirin, which include hypothermia, jaundice, tinnitus, diarrhea. So that will be aspirin का toxic effect होगा tinnitus. Clear? Nausea, vomiting, diaphoresis and ototoxicity, that is tinnitus, are earliest symptoms of aspirin toxicity. Then signs of acute poisoning are mild lethargy, convulsions, sweating, dehydration, hyperpnea, hyperthermia and restlessness. Then signs of chronic poisoning are skin rash, bleeding, weight loss, mental symptoms. Clear? 32. Which of the following signs and symptoms indicate salicylate toxicity? Chest pain, pink colored urine, slow pulse rate, ringing in ears. We have now already studied, that is ringing in ears. Okay. Which one of the following drugs can cause ototoxicity? Option A, aspirin. Option B, diclofenac sodium, paracetamol and ibuprofen. So here again it will be aspirin, ototoxicity. Clear? As a staff nurse, you are caring a patient with psoriasis. Salicylic acid is prescribed to the patient, which finding indicates that presence of systemic toxicity from this medication. That is again tinnitus. See, like how many types of question may come from one topic, one single topic. So you have to remember that they may ask in various form, but you have to read the question carefully. Now 35 में a client with rheumatoid arthritis is receiving ibuprofen. Which statement would indicate that client has a correct understanding of ibuprofen? Option A, I should take medicine between meals. This medicine will increase my appetite. The medicines may cause diarrhea. I should stop the medicines if my joint starts to swell. So option A will be the correct answer. Okay, all NSAIDs includes ibuprofen increase the risk of gastrointestinal bleeding and ulceration of gastric mucosa by irritating the lining of GIT. That's why the patient should take the medicine between meals. It will decrease the chances of gastric irritation, okay, or ulceration. So the patient should be cautioned not to take NSAID on an empty stomach, but rather take with milk, a meal or an antacid. Clear? Now which drug can be given in empty stomach? Thyroxine, pantoprazole, both, none. Option C, both can be, like both thyroxine and pantoprazole that patient can take in empty stomach. Then opiates, let's start. 37. Morphine belongs to one of the following groups of drugs, that is belladonna alkaloids. Option B, anticholinergic. Option C is opiates. Option D is barbiturates. So opiate means any natural substance that derived from opium poppy plant. Example, morphine, cocaine and codeine. Opiate means synthetic or semi-synthetic narcotic which work to bind on same receptor like opiate. Semi-synthetic opiate are heroin, ethyl morphine. Synthetic opiates are like pethidine, meperidine, then fentanyl, methadone, pentaxazine and tramadol. Clear? You mainly have seen that tramadol, right? In ward it is widely used also in patients. So this is painkiller, है ना? That will reduce pain in patient. So what is the source of drug morphine? Next question, see, animal, human, mineral, plant. No, this is plant. Now only you have seen that poppy plant, it is here written. So it will be from plants. An example of synthetic narcotic includes all the following except dilaudid, lyritin, morphine, tolvin. That is morphine. Narcotic means a psychoactive compound that producing stupor or sleep and also depresses CNS, thus relieving pain and cause sedation. Opiates and opioids are used as narcotics. It uses in severe pain like pain after surgery and in malignancy. In malignancy also patient feel much more pain, right? There is a chemotherapy, there is a radiation therapy, there is a like internal pain, psychological pain, like that all together patient feels severe pain, right? As a pre-anesthetic medication for sedation and to treat cough and diarrhea. Then dilaudid क्या है? Hydromorphine, hydrochloride. Lyritin में क्या है? Anileridine, a synthetic analgesic drug, piperidine class. Okay, tolvin में क्या है? Pentazocine and naloxone are synthetic narcotics. Morphine is a natural narcotic. They may ask you if morphine is synthetic or natural, then you have to answer it is a natural narcotic. Then in following which is not an example of opioid? Naloxone, pethidine, heroin, then morphine. Option A will be the correct answer, that is naloxone, है ना? Naloxone तो नहीं है. See, naloxone is not an opioid, it is an opioid antagonist और antidote. अगर toxicity हो गया opioid से तब हम naloxone देते हैं, ठीक है, which block or counteract the effect of opioid. Example है pentazocine in the brain. Non-opioid analgesic of the below is buprenorphine, then pentazocine, butorphanol and naproxen. So कौन सा वाला होगा? Naproxen. Naproxen is a non-opioid analgesic, non-steroidal, anti-inflammatory agent and antipyretic. Clear? Which of the following drugs is not used as antiemetic after recovery from anesthesia? Avomine, largactil, then stimetil and pethidine. Option D, pethidine. Okay. Pethidine में क्या है? It is a synthetic opioid used to relieve severe pain, not for anti-emetic, है ना? They have asked that emetic drug कौन सा नहीं है? Clear? So this is used for pain. So obviously this is not an anti-emetic. See, used as pre-anesthetic medication, not as anti-emetic. Then stimetil and largactil, that is prochlorpromazine, acyl hydrochloride, are antipsychotic medication used in psychotic disorder. It also uses in nausea and vomiting. Avomine में क्या है? Promethazine. It is an antihistamine medication used to treat allergic reaction, nausea and vomiting or prevent motion sickness. Clear? So all other three are antiemetic. Which antiemetic drug should be avoided in patients with liver dysfunction due to its cholestatic effect? What is that? Ondansetron, metoclopramide, then prochlorperazine, then domperidone. So prochlorperazine में क्या है? Sometimes it causes clinically apparent acute chronic cholestatic liver injury. That's why it is not given. It is avoided, है ना? One of the following is most common symptoms of opioid toxicity. Option A, constricted pupils, dilated pupils, high fever, dyspnea. So that is constricted pupils. See, opioid synthetic narcotic toxicity characterized by apathy, hypotension, bradycardia, respiratory suppression, low temperature, constricted pupil और क्या क्या है? देखो, constricted pupil also known as pinpoint pupil, है ना? Then constipation due to decreased bowel motility. So overdose of narcotics causes all the following except dilated pupil, hypotension, depressed reflex and option D is coma. So overdose narcotics में क्या होगा? So option A will be the correct answer. Clear? Option A will be the correct answer, that is dilated pupil. Okay, see. Then next 46, an emergency room nurse is assessing a 22-year-old male who has been using opioids. What symptoms indicate that the client has overdose? How you will know? That is constricted pupils and hypotension, yeah. Then vomiting and tachypnea, no. Pupillary dilatation and hypertensive crisis also no. Tremors and ataxia. Only option A is kind of showing that it is a overdose of opiates. Okay. Then which of the following objective assessment data will the nurse obtain before administering a prescribed opioid medication to a patient? Option A, pain level is stated by patient. Any nausea the patient may feeling, respiratory rate, color of the skin. Oh, so we know, right? Then in ICU or post-op unit, you have seen that after counting the respiratory rate only, we are giving opioid medication. Like example is morphine. Okay, this is a very important question from practical base. Clinical basis question में बहुत important है. That you have to check respiratory rate before you are administering any opioid medication. Clear? Then a patient received codeine sulfate for severe back pain. Which of the following observation must be done by the nurse? Option A, monitor fluid balance, monitor bowel activity, monitor peripheral pulses, monitor for hypertension. So that will be monitor for bowel activity. Okay. Next, morphine should not be used into which following condition? Pulmonary edema, angina, cardiac asthma, bronchial asthma. So we are not giving if patient is having bronchial asthma. It is contraindicated in bronchial asthma because it can precipitate attack of asthma by its histamine releasing action. Okay? क्योंकि ये histamine release करते हैं तो further constriction हो सकता है, इसलिए bronchial asthma नहीं देते हैं. Okay? It also depresses respiratory center. So that's why it will depress the respiratory center. by decreasing rate and depth of respiration. It also contraindicated into head injury and in acute pancreatitis. After morphine administration, nurse should closely observe for which of the following: nausea, respiratory depression, constipation, and restlessness, that is respiratory depression.